All right. Hello and welcome everybody to our Brown University Online MPH webinar, Why Brown, Why Online, and Why Now. Thanks everybody for joining us today. My name is Sparky and I'm going to be hosting our discussion today. So what is it that we are going to talk about? We're going to answer those three questions that I just mentioned. Why Brown, why online, and why now? So when it comes to why Brown, we're going to talk about Brown's history, mission, and its bona fides in public health and what makes it a great place to earn your Master of Public Health. That second question, why online? We're going to talk about Brown's world-class curriculum combined with that student-first convenience that makes us that ideal blend of quality and convenience for those who are busy professionals looking for a Master of Public Health. And then why now? What is it about this particular moment in history that makes Brown's 100% online MPH a great program for this moment in history? We're also going to look over admissions requirements just really quick. The final application deadline is June 1st. And so we want to make sure that we answer all of your questions and button everything up so that you're ready to get your application in by that date. We will have a live Q&A session as well. And so there's a Q&A icon at the bottom of your screen. And so you can click that at any time that you have a particular question that you want answered. We'll be sure to address that toward the end of our time together. Before I introduce our speakers, I just want to get a sense of where everybody's joining us from. So you're welcome to use the chat and just give us a sense of where folks are joining us from today. We're excited to see just kind of the reach of this program and where folks are coming. All right, so Matt, Matt's joining us from Michigan. All right, Baltimore, Maryland. Excellent. So we've got folks from around and around. So that is great. Oh, Ethiopia. All right, fantastic. We've got an international reach, and this is definitely meant to be an international program. So welcome, Newport, Rhode Island representing. All right, fantastic. So it looks like we got folks from a little bit everywhere. So that is exciting. All right, so I'm going to introduce our speakers here today. We've got three fantastic experts at Brown who are ready to answer these why Brown, why online, and why now. The first is Jennifer Nazarino. She is the inaugural Associate Director of the Online MPH program. She has been at Brown for about 5 years now, extensive experience in public health systems and in long-term care. Particularly one accomplishment to note is that she is the co-founder and co-director of the Philippine Health Initiative for Research, Service, and Training that's affiliated with Brown's School of Public Health. So we welcome Jennifer. Matt Wallace, Brown's Assistant Director of Student Recruitment and Marketing. Been at Brown for about 3 years, and prior to that, lots of enrollment experience in terms of helping especially adult students to earn that next degree and really take that next step in their careers, knows the admissions process back and front and back. And so we're excited to have Matt with us today. And then finally, we have Kim Pulaski. She is an enrollment coach at Brown University. And so her job is specifically to work with folks from that initial time that they raise their hand and say, hey, I'm interested in this program, to the time that they help them work through the enrollment and the application process, kind of there to be that side-by-side guide throughout that entire process, answering questions, providing help and support and resources all along the way. And Kim's been doing that for a baker's dozen worth of years, 13 years in that higher ed space, helping adult students start their degrees. So those are our presenters today. And so again, the goal of this webinar, we want to answer three questions: why Brown, why online, and why now? So I'm going to turn the time over to Matt to help answer this question of why Brown. Before I do that, again, let's pop into the chat and just share with us, if you will, why Brown? What is it about the institution, about the program that's intrigued you enough to look more into it, to join us here today? How would you answer this question for yourselves? Why Brown? What are some of the answers that we might get in the chat? Matt, what are some things what are some answers you might expect to a question like this?
Yeah, I mean, anything
from faculty.
Yeah, I just popped in. I'm just going to be a participant, I think, in this. But yeah, faculty, why not? Yeah, I love that. That's the best answer yet. Yeah, why not Brown? That's probably the better question. But yeah, there's so many different reasons, and the cool thing is like, there are so many great schools of public health out there. So honestly, we're happy with all the participants that are here. We're happy that you chose public health. That's the most important thing. There's a lot of different schools and each one is a little different. So you want to find the one that best fits you. But honestly, we need public health professionals more than we ever have before. So we're super psyched that you're here and we hope you choose Brown, and we're going to give you some reasons why you should, or why we would like you to be here. But honestly, anywhere you go, as long as you're making an impact in public health, we're happy. Integrated courses, that's a great answer too. Yeah, it's humbling to read these answers because it really makes you think like how lucky we are to be here at an institution like Brown.
Fantastic. All right. So we've gotten a little bit of perspective from our audience. So Matt, how about we dive in and talk a little bit more about and help answer this question of why Brown?
Sure thing. Yeah. Thanks, Sparky. And thanks everybody for joining us. Thank you, Kim. Thank you, Jen. And of course, all of our guests here today. I think it's awesome. And it's awesome that we're being joined from all over the place too, which is really cool. And that's what online is all about, right? That's online MPH. It's accessible, just like these virtual events. It's accessible to somebody in Newport, somebody in Michigan, somebody in Ethiopia. So it's just really cool. And public health is a global pursuit. So it's a global, pursuit. So it's just so great to have everybody join us. Brown's been around for a little bit, 1764. So before any of us were born, and I can say that I can make that joke because I'm the oldest here. So it's been around a long time, but we have a rich tradition. We also have a rich tradition of being very open, and you might have heard the open curriculum kind of thing before, but we've always been open and very inclusive as well. In fact, we were the first school to welcome and accept students from all religious backgrounds. So that sort of openness and inclusivity is still what drives us today. And it's one of those things that makes us unique. I mean, obviously it's a world famous research Ivy League institution, but it's really the culture that draws me to Brown. And you can see here, US News and World Report ranks Brown. This year's ranked in the top 8%, which is pretty awesome. 16 out of 195. It's like, what does that mean? Like, why? And really, these are peer reviewed, and so it means we're our academic excellence. It means our great graduation rates and our good job placement rates and our world-class faculty that are at the top of their fields and they love working with students. But honestly, when it comes down to it, it's the people in this room right now. It's students that make us great. Like, you're the ones that are making the real impact. I mean, just trying to think of a couple examples of our students. Just read an article on LinkedIn with Allie Beeman, one of our MPH alumna, and she's in Rwanda right now helping with HIV and AIDS, and she's in Uganda helping refugees with feminine hygiene issues. So she's doing a lot. We've got Chris Britton, who's going to be coming to Morehouse with me in about a week. He's working with adolescents and working on like environmental health, which is really cool, especially that those that are affected, marginalized communities that are affected and don't get enough green spaces, and it affects their health. We've got Summer Gonsalves. She's amazing. She's working with indigenous people here in Rhode Island, the Narragansett tribe, and helping them with food insecurity. So there's just so much of an impact that our students make on a daily basis. And that's really what sets us apart. And of course, it's nice to be in the top 5 for NIH funding, of course, especially as a smaller school, right? Because that means more funding per student. But those are just some of the reasons. And I'm going to kick things off to Jen to continue it on.
Hi, everyone. Welcome again. So I'm really going to talk about also particularly the program. And so I think what's really wonderful and unique is that we are really focused on integrating case-based learning. So our motto at the School of Public Health is learn by doing public health. And case-based learning is one way to do that. And we really want to integrate real world experiences, real world challenges, so that students can learn from each other across different parts of the world to really understand, how do we tackle issues related to COVID, long COVID? How do we deal with maternal mortality rates in different parts of the world? How do we deal with that even in the United States? And so I think case-based learning has really been one way for our school to really focus on just real world challenges and how do we talk through them as faculty, as staff, with students, and really figuring out solutions. And so that's really why we've very much focused on case-based learning. And so also when it comes to the integrated learning experience, and this is something that we really as faculty and staff thought about, like, what is the best final project that our master's students can complete once they have completed all their courses related to epidemiology, to health policies, to social determinants of health. And so the ILE really is focused again on not just creating, doing, and not just focus on the research part of public health, but they're actually connecting it to a real world problem going on in your region, your part of the world, and you wanting to find solutions for them. And so that's what we really wanted to create for your for the final project when you finish your MPH. Another great part of our program is the low student to faculty ratio. We really are focused on creating cohorts where you do have access to faculty. You can meet with faculty once a week or more, and they are there for you to talk through your projects, talk through your courses, and just your ideas and the experiences that you bring to the School of Public Health. And so we really are dedicating to be accessible to you all. And then world-renowned faculty, yes, there are so many wonderful faculty members at the School of Public Health that just really have amazing research and experience, and also have been doing public health in different parts of the world. And we want you to get access to these folks as well, and you will. And so we're also very much dedicated to working with students with their research and projects, as well as their learning and their ILE projects, so that you do get exposure to not just the research from the faculty. We want exposure to the experiences and the professional experiences you have, and working together to marry that is just what we're really focused on in the online MPH. And so here's just some faculty highlights. So I'm really excited to share with you that Alex Sullivan, he will be teaching our biostats course this fall, and he comes to us from Harvard, but currently also works at for the Takeda pharmaceutical company, but also is decided to come back to Brown University. He was a faculty member at Brown, a full-time faculty member, but now is joining us just for the online MPH, which we're very proud of. He actually won multiple teaching awards while he was at Brown University, and I know he will continue to now that he's come back. Alexandra Glacier, she goes by Alex. She's also a wonderful professor. She's a law professor from Boston University, who actually is now the president and CEO of a donor services company that they focus on tissue and organ donations all around the Northeast. And she will be teaching actually the leadership class for this fall. And then me, I'm going to be teaching social determinants of health. It's a class that I've been very passionate about. I've taught that class for a number of years now, and those are just pictures of me and some of my students. Monica Doshi, she has been a consultant for 20 years in public health. She is a global health scholar who has done a lot of research in India and Kenya and other parts of the world. She is joining us from the University of Michigan, and she'll be teaching interventions and evaluations. I also wanted to definitely highlight our leadership, who you will also have access to and learn from, which is Megan Rowney. She is the academic dean of the School of Public Health, but also is an emergency room physician. Ron Aubert, he is our interim dean, and he also has a lot of real world experience, having worked for the CDC as well as other healthcare companies, and you will also be learning from these folks as well.
All right, thanks so much, Jen. Appreciate that. So hopefully we've helped answer that question of why Brown for folks. So the next question is why online. So before we get into that, just a couple quick reminders for folks who may have joined us a little bit late. We will have a live Q&A at the end, and so feel free to submit questions at any time. I see we've already got some questions in the Q&A, so appreciate that. And so why online? Same sort of thing. Let's open it up. Let's open up the chat and just see what answers we get to that question. Why online? What is it about the online portion of this program that is appealing or intriguing to folks? Matt, Kim, Jen, what are some of the answers that you might have to that sort of question about why online before we dig into what we've got to share here?
Well, I'll talk about the flexibility. So what I love about working virtually and working online is that it works for my schedule. Where I'm at in my life, having 2 children, 2 young children, and a partner, husband, that where our lives are just at a point where this really works for me. And I love that I can create communities this way. I can meet people, not just at, in Providence, but all around the world. And I'm super excited about that. And that's why I'm very dedicated to the online space.
Yeah, absolutely. And as Matt kind of mentioned earlier, we've got a bit of a flavor of that here, even in this webinar. I've seen now Chicago, Boston, Newport, Ethiopia again. So I think that's a good representation of what we're all about. So let's dig a little bit deeper into this question of why online and some more of the reason why we feel it's an appealing option for folks.
Okay, so I'll take over. Hi, everybody. Thank you so much for joining us, as everyone else has said. And after listening to you, Jen, I think I'm going to sign up and apply for school. Those professors sound absolutely amazing. I mean, I'm excited, to be honest with you. And I agree with what Tao stated. Why not Brown? After hearing all those wonderful recommendations in the faculty members. So why online? I guess I just want to echo a little bit of probably what you all are thinking. Some of you are international. We have a huge international interest in this online MPH. So obviously those folks aren't going to be able just to pick up and move to Rhode Island. But even more closer to home, how many of us can uproot our life and just pick up and move to Rhode Island, right? So it ties into what Jen was saying. Probably the biggest reason of pursuing an online education at this point is because this really is created for full-time working adults. And so to juggle your work life, your educational life, your home life, family life, you've got a lot of balls up in the air that you're having to figure out. And so to be able to do an online format for your master's degree is going to be so beneficial. On top of that, I mean, you can see the points on here: accessible, flexible, affordable, more control, good preparation for a changing workforce. Yes, for sure. But one point I want to highlight is that this is an asynchronous learning environment. And so that really means you will know every week what your assignments are, what the expectations are, when your assignments are due, but you get on and you get your work done when it's convenient for you. So if you're up in the middle of the night having worked a shift and got off at 12 o'clock, school is open for you. Get on, get your work done. That's totally fine. If you find that you need some quiet time in the morning before the kids get up, get on, get your work done. That is totally fine. Whatever works best for you as the individual student. The other aspect I want to highlight, though, that is invaluable in this particular degree is the weekly discussion meetings. This is the only synchronous component that is really being integrated into the classroom. I want to highlight it's not mandatory, but it's going to be a wonderful opportunity to get to know your faculty, to engage with your classmates. You're going to have phenomenal classmates. I know the quality and the caliber of people who are applying for this program because that's my job. But I'm going to tell you now, those discussions are going to be incredible. And so you're going to go through relevant topics. You're going to be able to get involved in that meaty discussion. But the cool thing is if you can't make it one week, it's not going to be held against you. So why online? I just think in this day and age, this is what works for full-time working adults.
Yeah, great answers and great perspective, Kim. And I'm right there with you in terms of that the flexibility, accessibility, and just so much of the world has gone increasingly online in recent years, and so folks need that level of flexibility to be able to keep college life balanced with the rest of their lives, is how I like to think of it. All right, so we've answered why Brown and why online. So the last question that we plan to answer for the moment is why now? What is it about this moment in time in the history of the world that makes a Master of Public Health, and specifically Brown's Master of Public Health, a worthwhile degree, something we're pursuing? Again, we're interested to see perspective of folks who've joined us today in terms of what is it about this particular moment in time that makes this program appealing for you, makes it a path that you want to go down. So again, feel free to put answers in the chat. Obviously, we've all lived and are still living through the COVID-19 pandemic and all of the kind of ripple effect that continues to persist from all of that. And so public health has perhaps never been quite this long in the spotlight for so long. And yeah, Matt, I think you're right. You know, no time like the present. Why was that your dad's favorite saying, Matt?
Oh my
why was
gosh.
that?
Yeah, he's like, don't procrastinate. You're gonna have to do the same work either later or before, so you might as well do it now. No time like the present. That's my dad. I don't know why he sounds Southern in my head, because he's not Southern, but that's just his voice. So yeah, as Sparky was saying, you know, we are in the middle of the most important public health moment of our lives. I mean, not just with the pandemic, but we have multiple crises going on right now, and that have been going on for a very long time, and they kind of been brought up to the surface, right, from the pandemic. And these kind of disparities that we're seeing in communities are getting wider throughout this pandemic. And so you know, it's time to tackle these challenges. And honestly, it's time to think about a little outside the box, because what has been happening, the kind of old school way of doing things in public health, it aren't working. I mean, you could talk to the people that are in the trenches, and they'll tell you the exact same thing, that we need to think outside the box. We need to think creatively. Like, how do we deal with the opioid epidemic? Well, I'll tell you what. Brown University and the research that we did allowed for the very first harm reduction clinic to be opened in the United States in Providence to help fight this opioid epidemic. And it may sound controversial and bold, you know, because you're essentially allowing a safe place for people that are saddled with addiction to do drugs. But at the same time, the data shows that this will save lives, and you save lives, you prevent overdoses, you provide education, and you provide support, harm reduction. So these are the kind of bold things that are long overdue, and other countries are doing them, but not the United States. So we need to have this thinking. Same goes for climate change. Same thing goes for structural racism, migration, gun violence. I mean, we're seeing examples all the time, sadly, on the news. We saw what happened in Buffalo just a couple of days ago, which is a combination of gun violence and racism. So these are problems that we really need to kind of join together and think creatively. And I think one of the coolest things about Brown is that our mission is not only to make the world a healthier place, you know, that should be every public school's mission, but it's really to focus on the marginalized populations, the vulnerable populations. These are the populations that need it the most. And that's what Brown is all about. So hopefully you feel the same way.
And not only is it why now for the moment in history, but there's also opportunity that comes along with that when it comes to you know, career growth and influence. And Jen, I know you've got more to share about that.
So definitely there's a lot of jobs in public health, which is great to see, but it's also showing the need for new leaders in public health. And why we're so invested in having leadership courses as part of this program is because our leadership has to grow. We need these skill sets in order to lead in the public health challenges we're facing today. And so if you're at a time in your career where you think, you know what, I'm ready to move up, I'm ready to take charge, I'm ready to become a leader. And this is a program that we hope that you choose that will provide those skill sets for you and bring not just world-renowned faculty, but faculty that are on the ground. that actually are leaders, in their respective fields. And so we definitely are seeing job growth in health education specialists, service managers, and biostatisticians, are just to name a few, but also in terms of be standing up and being leaders to advise policy. There's a lot of public health misinformation there that is not being propagated by actual public health leaders. And we need to take that stand and really think about the marginalized populations, those populations that have been made invisible, those voices that are not heard. And so that's why now? Because there's just so much going on in this world where public health plays such a critical role. And we want to develop new leaders, but also meet leaders with the research, with the data that we have in public health to be much more informed about public health issues.
Great insight, great perspective, Jen. So those have been our primary questions in terms of why Brown, why online, and why now. And we're going to be able to address any other questions that you have a little bit later on. But before then, if you may be asking now yourself, okay, I've got the answers that I want to why Brown, why online, or why now. And so what's next? What do I need to do? And so Kim, I'll turn it to you to just give a quick overview of admissions, application requirements, and the like.
You got it. Absolutely. This is my wheelhouse right here. Okay, so our final deadline is June 1st. And looking at the names of our participants, many of you are in the middle of the process, which is fantastic. Some are just getting started. So this is going to be addressed more to those who are just kind of getting started with the process, because you are going to have to be very, very focused over the next 2 weeks to get your SOFAS application done. So we use, you can see in there in the first bullet point, SOFAS. SOFAS is an online application platform that applies to public health programs across the US. Here at Brown, we use this particular application process. It is meaty, so just know that. And I'm going to go through the documents right now in order of where I think you should start based on my experience here. Your 3 letters of recommendation, okay? So 3, not 2, you need 3. You can do a combination of academic and professional, or you can just do professional. You will want to identify people who will get the job done for you quickly. I would not suggest waiting to give them a deadline of May 31st. I would suggest sometime in the middle of next week, the 25th, 26th, maybe even the 27th of a deadline, but pick people that'll come through for you and can speak loudly on your behalf. So start there. Second step are your official transcripts. You will need all official transcripts from all colleges and universities that you've attended. One thing that we are seeing happen, if you don't put all of your schools down, SOFAS will kick it back after you've submitted it, and you have to then go back and order whatever transcripts they're requesting from you. So just save yourself a little extra step there. Get every single school you've attended listed in SOFAS. After that, you're going to do your resume or CV, whichever approach you want to use, and then your personal statement. Your personal statement is really designed to show your passion for public health. So anyone I've talked to, I've told you, share your passion in this field. Why do you want to pursue online? What have you done previously that has really sparked your love and interest of public health? What do you want to do in the future with this particular program or goal that you have in mind? I know most of you are partnering public health with other things you're doing, and you just, when I talk to you on the phone, I can feel the glow come through the phone, the passion come through the phone, and I love it. And that's exactly what we're looking for. If you are an international student, you will need to have your transcripts evaluated by WES. And then there is also a language proficiency exam, the TOEFL or the IELTS. And we can, the enrollment coaches, there's 3 of us, we can talk to you about that a little bit more individually. And then merit-based scholarships. What is on the table right now for the first year of the program are merit-based scholarships. And so there's no additional application process for this. Every single accepted applicant will be automatically considered for a scholarship, and the range will be 33%, 50%, or 100%. And you'll be notified at the time you're notified of your acceptance. I think I've got everything. Oh, the application fee. So we do have some application fee waivers. You will want to contact your enrollment coach. Again, there are 3 of us, but we should have more information on that very, very shortly so that you can apply for those fee waivers and be able to submit your application without an additional cost.
All right, fantastic, Kim. Thanks for all that. And yeah, as we said, that June 1st is coming a lot quicker than we might think. So you know, the best time was yesterday. The next best time is right now to keep going on that. And again, we'll have a phone number and an email address at the end to get a hold of your enrollment coach if you haven't already, or just for any additional questions. But we also want to take some time to answer any questions that we have from our audience. So go ahead and click on that Q&A icon at the bottom of your screen and submit a question. I'll go ahead and we've kind of answered the first one here already, Kim, but the question is, will the GRE be required for fall 2023 cohort? Are there merit-based scholarships offered by Brown to incoming MPH? So we talked about the merit-based scholarship. What about that GRE requirement? Is that something that folks need to consider?
I am so happy to say you are not needing that GRE. So congratulations.
Okay, fantastic. All right. Next question. How often will a new cohort begin? We're really you know, that June 1st application deadline is for, you know, for this fall, for classes starting in September. And then what does the future for the program look like in terms of how often will new cohorts begin? Maybe Jen or Matt, any insight that you have on that?
So right now we're focused on the fall intake. So the 1 cohort right now, we are thinking about multiple cohorts, but currently as of now, we are just focused on the fall cohort.
All right. So just to emphasize, the idea is that if you're interested in this program, now's the time, take advantage of this opportunity and plan to start in the fall. This fall, it sounds like. Okay. Fantastic.
Can I piggyback a little bit off of that first question as well? I just wanted to let you know, just like the thought process behind the GRE, like we met about it, and we really felt as a school that it wasn't a very good indicator of success for our students. And Brown is all about accessibility and trying to make our education accessible to everyone. And the thing with the GRE and a lot of these standardized tests is they kind of tend to benefit those that have the money to take test prep and things like that. So they're kind of a disadvantage historically to minorities, to those with lower income. So I don't need to get on my soapbox about the GRE or anything like that, but not only is it not a good indicator of success, but it's also kind of dubious. But that being said, the program, as you can expect, is academically rigorous. It's Brown, right? It's Ivy League. So we want you to be set up for success. And part of the MPH is that quant side, right? That quantitative learning. So just be prepared for that, be able to maybe speak to some of your skills, whether or not you've taken classes like statistics or probability or anything like that. That'll help you, especially with your first sets of classes with like biostatistics, epidemiology, those types of things.
All right, excellent. Appreciate that, Matt. All right, Kim, I think we'll go back to you for this next one. Question. There seems to be some overlap between the personal statement prompt and the subsequent questions. Why are you applying, et cetera? So is it okay to have some overlap in your answers and content? Kim, what would you advise there?
Yeah, absolutely. I think with the personal statement, the title of it kind of speaks its value, that it's personal to you, that again, show your passion, show your love for public health. This is really a chance to kind of even brag about yourself, if you will. But those other questions with the red asterisks in SOFAs, those are absolutely required. So just take a few moments and definitely, answer those. But if there's some overlap, that's okay.
Yeah, redundancy is okay, right? And what do they say in advertising? Somebody has to listen 7 times before it sinks in. Well, our faculty reviewing committee is the same way. So if you have to kind of hammer the same point home, there's nothing wrong with that. And I think, Jen, you wanted to add something to that as well?
Yeah, and I just want to say we look at applications holistically. We want to know about you. We want to learn about you. We want to hear about your personal experiences, professional experiences related to public health. That's so critical and important. And so really take the time to put yourself out there, and share with us, because we do look at applications holistically. We do the way that we assess applications, and maybe even write about why Brown, why now, why online. I mean, we would love to read about that and hear from you about that.
Yeah, and Jen reads your applications, so take her advice. And it's one of those things where it's like you may feel intimidated, right? Because it's Brown, but it's so much less. And like Jen said, it's such a holistic process, and it's so much more of like, instead of are you good enough for Brown, it's so much more, are we good enough for you? Do we have the faculty? Do we have the connections? Do we have the resources that you need to be successful? So if you're as transparent as possible on your personal statement, we can see, hey, we're a great fit. And then moving forward, when you do get accepted to Brown, you're put into a position of success, which is really awesome.
Fantastic. Great from everybody. All right, so some more questions here. So let's tackle these one at a time. So first, what kind of financial support is available for the second year of study? So let's talk there. We talked about kind of the merit-based scholarships and being considered when they initially apply. In terms of kind of the long-term vision for the program, what other kinds of financial support might be available as someone progresses through the program? So let's address that one first, then we'll get to the second question afterward.
So in terms of, like, I just want to say, in terms of the merit-based scholarships, those scholarships are for the whole time you're in the program. It's not just for the first year. So I want to clarify that. It's not, if you do get a merit-based scholarship, it is assisting you throughout your time at Brown, all the way till you finish the program. So want to clarify that. I know that we don't have need-based scholarships now, but we're hoping and we're planning to have those scholarships available soon. Also, there is you can apply for financial aid. Matt, do you want to talk about other support that we can provide?
Yeah, I'll just pop it in the little chat here, but ASPPH has a lot of really cool ways to finance your degree too. If you have to take out loans, that's okay. I guess, education is a good investment. If you're going to invest, it doesn't depreciate over time, right? But that being said, if you can avoid taking out loans with interest rates, that would be advantageous, right? So I would definitely try to exhaust your outside scholarships before you decide to take out loans. And if you do take out loans, take out government loans, not private loans. But there's a lot of opportunity for a lot of different groups and communities. And if you've been part of partnerships or Peace Corps or so many different organizations, so there's opportunities out there. You have to put in some work, for each one, but it's definitely well worth it.
Yeah, that idea that, it's a graduate program, so, there isn't as much financial aid available, or the requirements are different. And I think to your point, Matt, I think there are more options out there available for people than might meet the eye initially. So that's some great perspective. And then the second question here, does the degree hold the same weight whether it's earned online or from a campus-based study? And I think as online learning has grown, especially in higher ed, I think it's a question that more and more people have asked. And so from our panelists here, what's your perspective on that question?
It holds the same weight. It is accredited by the same governing body that looks at all MPH programs. So it's definitely equal in all aspects of like online versus in person. It's just what works for you, what program works for you, and where you're at in your career. And I think that's what you need to ask yourself, and if the online program is what works for your schedule, wonderful. But we also have the in-person program too. And if that's something that you'd be interested in applying to, that's available as well.
Yeah, the degree is the same. The diploma is the same. The accreditation is the same. It's not going to say online on your diploma or your degree or anything like that. So yeah, and to piggyback off of what Jen said, it's really what works best for you.
Mm-hmm.
Yeah, fantastic, great. So this is not a question, but a statement. It says SOFAS has 3 different sources to upload education credentials. Not all schools, universities are listed using one. I had to use all 3, so do not get discouraged. If you don't see your school listed under one, try another. So Vincent coming in, help him play that enrollment coach role a little bit. Yeah. Just in terms of, hey, don't give up, stick with it. We got it. Any other kind of quirks like that, Kim, that are part of, or Kim or Matt or anybody based on the application? Any other things to maybe consider for that?
Matt, does anything come to mind for you?
Well, that we want to hire Vincent next. That's the only thing I can think of right now.
Yeah, me either. That's great. Thank you, Vincent.
Yeah. Fantastic. So Jen, you mentioned, it's whatever works for folks, if it's the online or the campus based. So this question kind of talks about a little bit of a blend of both. If you're enrolled in the online program, but you live close to the university, would faculty be open to meeting in person? Is there a possibility to attend live classes? How would you answer that?
No, that's a great question. I do want to, if you look at the online MPH, our courses, there's some really unique courses that are really specific to the online. So there may not be a course in the in-person that is equivalent, but we definitely want you to come to campus. You want to come to campus, meet our faculty, come to our events. If you do want to sit in a class, definitely reach out to the faculty member teaching that course to see if you can sit in that class. But we're very open, but I do want to say that the generalist online MPH program that we have, that is very specific around leadership, communication, and data analysis, as opposed to the other concentrations, where that may be in epidemiology or biostats or other concentrations. There just may not be an overlap of those kind of courses.
Yeah. Each program is kind of really cool in their own way, but they don't overlap, like Jen was saying. And I think the coolest thing about the online program to me is that case-based learning. Like, that's super innovative, and that would be the best way that I would learn, to actually have a real world situation. How do you deal with this? Like, let's say there's a meningitis outbreak, right? How do we communicate to that? How do we gather the data to figure out if this is going to get worse or get better? What do we do with schools? Those kind of communication and leadership kind of tools that you'll be learning by kind of dealing with these real world situations and real data, I just think is so unique. Whereas the in-person MPH is a little bit more traditional. It's a little bit more of like the professors at the front of the classroom, and you're taking notes and things like that. So they are different, and you can't really kind of go in between them. But as Jen said, I mean, you're still part of Brown. You're still part of the community. You can come and attend events with us and meet faculty and staff and fellow students. Yeah, absolutely. It's a very collaborative community. It's a very warm community. It's one of those things where I didn't know what to expect when I first came to Brown. I was like, Ivy League, I don't know, is it going to be like elitist or something like that? And it's so not. Everybody is so down to earth. So it's not only like the best and brightest people, but it's also the warmest people. And I guess you could expect that with public health in general, just because public health tends to be one of those fields where people are selfless and have big hearts, right?
All right, great questions from our audience. So let's see, I guess kind of a last call, so to speak, for any lingering questions that we haven't talked. All right, Tao coming in. What are faculty's goals for this online MPH program in 10 years? Okay, so Tao's got the long view with us here. So Jen, how would you answer that?
I mean, I love that. I mean, like, faculty goals, our goals is to create, again, as I said earlier, the best leaders in public health. That really address issues that we have talked about throughout this information session. And also we want to think more global. We want to connect people globally, that, that there's a lot of public health issues that are not just affecting just one part of the world, are affecting all of us. And so that's really what our intention is to not just produce the future leaders, but connect us in a way that we haven't been connected before, and actually learn from each other and actually figure out ways to be more innovative around solving today's and tomorrow's public health issues.
All right. And Tao says he's an urban planner. So that adds a little bit of flavor to that.
How I love that. So I will say that, you know, that question about like events, you know, or coming to Brown, like, don't just come to public health, go to other parts of Brown University. We're very interdisciplinary. I really mean that. I work with sociology faculty. I work with public policy faculty. I am a fellow at the Center for the Study of Race and Ethnicity in America. Like, there's just so many opportunities to be more, to think about your degree from an interdisciplinary perspective. And faculty want to meet with you. Faculty want to talk with you about what you're thinking about, what you want to solve. So I would invite you to not just reach out to faculty and staff in the School of Public Health, but across campus.
All right, fantastic. All right, any last questions? Anything else that's still on any of our attendees' minds that we have not already talked about? I don't see anything in the Q&A. Going once, going twice. All right. Well, thanks everybody for your attendance and for some really great questions and really great discussions. Before we wrap up, just a quick overview of some of these upcoming deadlines and important dates that are coming up for the program. So again, as Kim mentioned, that final application deadline is June 1st. Admissions decisions are rolling. Jen, are there any other dates around admissions decisions that need to be, that these folks need to keep in mind?
We're going to really try, we're doing everything we can to get decisions out once you turn it in, like within four weeks, 4 to 5 weeks of getting you that decision. So that's why we've incorporated the rolling admissions, because I know you're thinking of other schools. We totally get that. And we totally understand that. And you need to plan your life. So just wanted to let you know that, you know, we are trying our best to go through. We have a faculty advisory committee that is looking through all the applications and really trying hard to make sure we get those decisions out to you as soon as possible.
Mm-hmm. Yep, fantastic. And again, we're really focused on that fall, on this fall for 2022. And then Matt's helped answer that question there about fall 2023. So classes start on September 7th. That final application deadline again is June 1. And so as Kim mentioned, please connect with your enrollment coach if you've already met up with one. If you haven't yet, we've got a phone number and an email address there, 888-584-5166. Email address is brownenrollmentretention@mph.online.brown.edu. And so thanks again, everybody, for your time and attendance and for your questions here today. It's been a great discussion. And we hope we've helped answer some great questions for you and help you make an informed decision to join Brown's Online MPH. So thanks again, everybody, and have a great rest of your day and week. Take care.
Thank you.
Thanks, everyone.
Right.